All right. Well, good morning, everybody, and welcome to our Tuesday morning Impact Health educational webinar. My name is Lauren McQueen. For those of you that don't know me, I live right outside of Austin, Texas, in the beautiful Hill Country. It is definitely summertime here, but I'm so excited for you all to be on today. For those of you that are first timers, we actually do this Impact webinar every single Tuesday morning at 11 a.m. Central, at 12 p.m. Eastern. So feel free to come back on here. It is such a great call. I see a lot of familiar faces, but a lot of new faces as well. You heard some people say that, hey, I signed up as an Impact member. Now I'm on here to learn a little bit more about my plan. We have people who got a quote and now they're just interested in learning about Impact before making the decision to get started. We have doctors on here who are looking for ways to partner with Impact Health and become a preferred provider. So wherever you fit, welcome. We're excited to get started. Just to give you an overview of what to expect today, we're going to take about 45 minutes of your time, do a deep dive into all things Impact Health related, and then we're going to open it up for some Q&A at the end. So feel free, of course, you can put questions in the chat. We'll be able to answer them for you, or save your question to the end. I'm sure if you have that question, other people might as well, and we'll get those questions answered for you. So who would agree with me that the health insurance system right now is pretty broken? Right? There is a reason over 100 million Americans are in some sort of healthcare debt. And so what we have our hands on with Impact Health Sharing, we believe is disrupting that really broken system, and not just disrupting the health insurance industry, but disrupting the health sharing industry as well. So you're going to learn a little bit more today about what health sharing is. Impact Health is not traditional insurance. It's healthcare sharing, and it is phenomenal. A little background on me, I've actually been an entrepreneur my entire life. So many benefits to entrepreneurship. So if you're self-employed or a business owner, you know what I mean, but we don't get the benefit of having someone like an employer cover our healthcare costs. And so that's always been out of pocket for myself. My husband is a business owner. They have many, many W-2 employees and over 500 1099 employees. He owns a roofing company. And get this, 70% of his employees had no type of healthcare coverage. And these are people that are getting up on roofs every single day. So we've been able to add massive value to his employees, to our family, getting great affordable coverage. And so I'm really passionate about Impact Health and excited for you all to learn a little bit more. So what I'm going to do is I'm going to share my screen and let's just run through a quick presentation. So we have a Facebook page that I want to invite you all to, and you can see, you can scan the QR code on here with your phone camera to get taken directly to the Facebook group, or you can just type in Health Share Crusade Community. This is where we post the recordings of these webinars. So if you want to share this with someone, or you missed part of it today, or you want to rewatch it, just jump in the Facebook group. Once we get the recording up, we'll post it in there. We also have phenomenal testimonies in this Facebook group of Impact members that have used their Impact cards, and they're showing you the savings that they've got with Impact and how seamless of a process it was. You do not have to be an Impact member to be in this Facebook group. So everyone is welcome to join, just request and we will accept it. But let's dive in. So let's talk about some truths about healthcare right now in our country. Over the average individual in America paid $780 per month, and the average family paid $2,000 a month for marketplace health insurance in 2022. Unfortunately, even 2 years later, those numbers have increased. And in 2019, 59% of bankruptcies cited medical expenses as a major factor. And so 80% of our country, they're trying to lower their healthcare costs. I don't think that's a surprise to any one of you on here, but understand this, 5% of the population are responsible for 50% or more of the annual healthcare spending costs. So what this means, and really let that sink in, that 5% of the population is responsible for 50% or more of the annual healthcare spending costs. What does that tell us? People are overpaying for their healthcare every month. And like I said at the beginning of this call, a shocking 100 million Americans, over 100 million Americans, are in some form of healthcare debt. And so what are people looking for? for? They are looking for affordable monthly premiums. If you have health insurance, chances are over the last few years, you've probably noticed an increase on your monthly premiums for you and your family. But people are looking for affordable copays, affordable deductible options. They want medical freedom. They want to be able to go and choose the doctor, choose the facility, and not be confined to a specific network of doctors. And employers like my husband's company, who prior to Impact was not offering any type of healthcare, they want to be able to offer healthcare to their employees. I just got off the phone with a business owner today. Him and his family, they have 4 people in their family. They were paying $2,200 for themselves through traditional health insurance, got them a quote with Impact Health, dropped their cost down to $628. Imagine a business owner like himself having employees where those are the prices that they're seeing, how much money they'd be able to save by switching those employees over and getting them covered with Impact Health. And so let's talk about health sharing. I know a lot of you, like I said, are familiar with traditional health insurance. Maybe the concept of health sharing is new to you, but health share programs are not a new concept at all. Matter of fact, they've been around for over 40 years, and they originated in churches where church members would actually pay each other's medical bills. And so that's kind of what health sharing is. It's where you pay your monthly payment into a pool where other people are paying their monthly payments as well. And when someone has a medical need or a medical expense come up, through an AI technology, those funds in that pool are actually reallocated to cover the cost of someone else's medical bill. And so essentially you're paying and sharing into other people's medical bills. And Impact Health and health sharing programs are not for profit. That's why we're able to help people save so much money. There's no profit margin in there. But traditional, health share programs, maybe you've heard of MediShare, Christian Health Ministries, Samaritan Health. A lot of them are actually faith-based, where you have to prove to be a certain religion or faith in order to enroll and become a member. With Impact, it's a come one, come all program where you don't have to prove to be a certain religion. Anybody can be an Impact member. A lot of other traditional health sharing programs, they have you pay up front as a cash pay member and then submit your bill into your health share company, and they would either reimburse you or put that towards reaching your deductible. But with Impact Health, we do not have our members have to pay up front because it feels more like traditional insurance. So you go to the doctor, you go to an urgent care or whatever, and that provider is going to be able to bill Impact Health electronically, make it a much more easy process for you and your family. So some of the benefits of health sharing in general, though, low monthly costs, so much more affordable than traditional insurance, where we're helping individuals, families, and even small businesses save anywhere from 30 to 50% per month. Negotiated rates for medical and pharmacy services. And so what Impact does is they contract with established provider networks, and they negotiate fair, reasonable, and affordable rates for typical things like a doctor's office visit or a 30-day supply of prescription medication. You're going to see some phenomenal examples of how we reprice our medical bills. And so what happens is when Impact receives a bill from your doctor, your specialist, the urgent care, your hospital, whatever it is, they're going to look at the price of the bill and they're going to say, this is not fair market value. And they're going to negotiate that price of the medical expense with that provider. On average, Impact is negotiating the price and lowering the cost of those medical expenses down by 72%. Okay, so keep that in mind as you look at some of these examples. But why Impact specifically? Well, we offer comprehensive medical care. I already mentioned this, but you have nationwide access into all networks. There are no network restrictions. So I can take my Impact card, I'll show you what it looks like. I can take my Impact card and go to any doctor, any physician I want to. And not only is that convenient, but what that tells me is that if you have a concern or an issue or medical issue come up, you can go get the best possible care for you and your family and not have to worry about if they're out of your network. Out of network costs with traditional insurance add up very quickly. They're very expensive. I tore my meniscus probably about 5 months ago now, and I'm so grateful that all I had to do was open up the maps on my phone, type in urgent care. I could go to the closest urgent care to me without having to call ahead of time and ask them, are you within my network? All right. We also offer unlimited telemedicine. So 100% free for you and your family. And what I mean by telemedicine, for those that aren't familiar with it, it is if you don't want to go into a physical doctor's office, but you have something come up, you can actually have a phone call or a video appointment with a doctor, get the medical attention you need out of the comfort of your own home. It's free. It's 24/7 access and unlimited appointments for every single member of your family. I've utilized this before. By the time I submitted my ticket to have a doctor call me, they called me in under 5 minutes time. I was blown away. We have fantastic wholesale prescription pricing, actually the lowest in the industry. And we have plans starting as low as $73 a month for individuals and $378 for families of 3 or more. This is a big one, so listen carefully. So we offer household PRAs. A PRA stands for primary responsibility amount. It's the same thing as what a traditional insurance would call a deductible. So a lot of insurance companies, you're going to see that they have individual deductibles to reach, but with Impact, it's a household deductible starting as low as $2,500 for the whole year for the family. So if you have 12 people in your family, all those 12, people's medical bills go towards reaching that one PRA as low as $2,500 for the year. And like I said, we are a not-for-profit. This is also very important to understand that those that do not have social security numbers, as long as they have an ITIN number and a legal form of ID from either Mexico, Guatemala, Canada, or the US, they're able to become Impact members as well. And so that just really allows us to expand our reach to so many more people where their top concern is not just, can I get coverage, but it's, can I actually afford it as well? So huge benefit there. But let's talk about who our target customer base is. So our target customer base are individuals and families who are overall fairly healthy, who are currently paying some or all of their healthcare costs. And in total, about 91 million people fall into these 3 categories. Non-group companies, what I mean by that is small businesses with 49 employees or less. Those that are self-employed like myself, independent contractors like people who work for my husband's company, gig or part-time workers, those that are underinsured, and then of course, those with no insurance as well. And so I get this question a lot. Well, Lauren, talk to me about pre-existing conditions. So I just want to say anybody and everybody can be an Impact member. No, they're not going to deny you based on a pre-existing condition or, a medical need that you have. And so our definition of pre-existing conditions are conditions in which known signs, symptoms, testing, diagnosis, treatment, or use of medication occurred within 36 months, so 3 years prior to becoming an Impact member. So once you are signs, symptoms, treatment, diagnosis free for 36 months or 3 years, then you're able, it's not going to be considered a pre-existing condition. And so with pre-existing conditions, let's say you have a medical bill that's associated with a pre-existing condition, those bills will still get repriced. Remember, we talked about how Impact on average is repricing and negotiating medical bills by 72%. So your bills associated with your pre-existing condition still get repriced. The only difference is that repriced amount is not going to count towards reaching your primary responsibility amount or your deductible. Okay. So we have people who they have a pre-existing condition, but they're not having a lot of, doctor's office visits, and they don't have a ton of medical expenses associated with that. They're not on very expensive prescriptions. They're still phenomenal candidates for being an Impact member. Matter of fact, I had someone on the phone with me today who he has a pre-existing condition, but he goes, I have 2 checkups a year and that's it. And so he's like, I'm excited to enroll with Impact Health. Now, if you're somebody who does have a long-standing, pre-existing medical condition where you have expensive prescriptions, where you are having to go to checkups once a month, or you have procedures associated with it, Impact might not be the best fit for you, but we're finding that the majority of people, Impact is a phenomenal fit for. Now, when it comes to high blood blood pressure or high cholesterol, those will not be considered pre-existing for purposes of determining eligibility for future vascular or cardiac events. Okay, so let me show you a real life example of actually one of my husband's employees. He lives outside of Denver, Colorado, and this was a pre-existing condition. So he had blood clots actually in his legs that unfortunately this was something that he had for a while, and he had, you know, a flare up or whatever you want to call it, went to the ER, and his emergency room bill was $5,751.28. They billed Impact directly. Impact negotiated the price of that medical bill with that provider, and they negotiated it down by $5,130.75. So all this gentleman was responsible for was $620.53. Now, because it was a pre-existing condition, that $620 did not go towards reaching his primary responsibility amount. Had it not been a pre-existing condition, that amount would have went towards reaching his PRA. So I hope that makes things a little bit clearer for you. But you guys, I'm excited to actually introduce my co-host. I'm going to kind of turn the call over to him, but he's going to go into more examples of Impact Health as far as the repricing, talk about what it's like to be an Impact member, go over, you know, what things are shareable within the community, and just give you more specifics on Impact. And so with that said, you guys, this gentleman, he's taught me all I know about Impact Health. He has studied Impact for a while now. His family has a phenomenal testimony, and he's literally helped thousands of people when it comes to saving money with Impact Health. And so with that said, I'm going to turn the call over to our Regional Vice President Platinum, Mr. Jeff Street.
Well, Lauren, thank you so much, and just phenomenal information that you gave everybody today. And we appreciate you just being on the crusade to really be a disruptor, you know, in this industry. And I appreciate you leading by example. And I think all of us would agree that affordable healthcare is a major problem in our country here today. And I believe that's why there's close to 200 of us that are on the call here today. And we just want to thank you for your time today to come and learn about an alternative of the high cost of traditional health insurance. And it's really simple for you to be able to go out and get a quote. And I'm going to show you the quoting process. I'm going to kind of break down the quotes, and I'm going to go over the experience of what Impact is like as how we utilize it as a member. And at the very end, we'll do Q&A for those of you that are on the call for the first time. Definitely jot your questions down, because we'll give you an opportunity to ask questions at the end. It'll be a great opportunity for everybody as we recap today's session to be able to learn from the answers to your questions. But when it comes to getting a quote, you know, whoever invited you on the call here today, they are a referral partner, just like myself and Lauren, with Impact Health Sharing's marketing partner. And they have a referral link, basically like an affiliate link, that they'll send you. And then all that you're going to need to be able to get a quote with their link is the birth date of the oldest member in your household, how many members are in your household, and then you're going to get the results immediately. And so we're going to do a little example here of an individual, or a family rather, where it was September 18th, 1969 is the date of birth of the oldest person in the family. In this example, it's a family of 5. So I'm going to actually just go to one of our referral partner links so you guys can see what this looks like. And for those of you wondering yourself, hey, is there a business opportunity here? Can I be a referral partner? The answer is yes. You'll have a link that'll look similar to the one that I'm going to show you. And, you know, there's a business opportunity here as well. And those of you that want to learn more about that, make sure you get back to the person that invited you at the end and say, hey, I want to learn more about being a referral partner. But this is what the referral partner link looks like. This is actually one from one of our referral partners here in Texas, where Lauren and I live. This is the Texas Chiropractic Association's link. And so right on this link, we just have that date of birth, September 18th, 1969. Remember, it's a family of 5, so 3+. And all I'm going to do is simply just hit get a quote. And instantly that quote is going to pop up for this family of 5+. Now, with every quote that's generated, there's 4 options on each quote. Now, everything about each option is exactly the same, other than the standard rate that they pay each month. Now, standard rate, those words are synonymous with what most of us know as a monthly premium, and then the primary responsibility amount. And again, as Lauren mentioned earlier on, primary responsibility amount, those words are synonymous for like a combined family deductible. So as an example, my wife and I, we had traditional health insurance. We had a high deductible plan to try to drive our price down. And we had a $7,500 deductible, but that was for each one of us. With Impact, we're now on a plan that's a $2,500 PRA for the two of us. That's a combined PRA or a combined family deductible annual for the two of us. And I'll show my quote here in a minute, but let's start with this quote again. So there's 4 different options for this family. They have a $2,500, a $5,000, a $7,500, and a $10,000 PRA to choose from. And again, remember, PRA is like combined family deductible. Now, the standard rate, the lower the PRA, the higher the standard rate is going to be per month. The higher the PRA, the lower the standard rate is going to be each month. So you see that for this family, it's going to range from $456 a month if they went with that $10,000 PRA to as high as $628 a month if they wanted to do what my family did and go with that lowest PRA for the family. Now, the member is responsible to meet their PRA, and at that point, sharing will begin with our community. Now, once sharing begins, what's really one thing we really love about Impact is with traditional health insurance, like my former health insurance company, whenever I hit my deductible, it was then an 80-20 split. And what that meant is once I hit my deductible, my insurance company would cover 80% of my eligible medical bills, and I was left with 20% was my responsibility. With Impact, there's what's called a 10% co-share. So here's what this means. Once you've met your PRA, the community will now share in 90% of your eligible medical bills. Your responsibility is just 10%. Now, the most that you could ever pay per year for a co-share for your entire family is $5,000 a year. So think of that like a max out-of-pocket expense. If your family ever pays more than pays $5,000 for that 10% co-share, moving forward from that point forward, the Impact community will share in 100% of your eligible medical bills. So again, for this family, the $2,500 PRA is $628 a month. You know, as they go out and have medical situations and they use their Impact membership, they're going to be responsible to meet their PRA before the sharing begins. Once the sharing from the community begins, again, it's a 90-10 split. The community will share in 90% of their eligible medical bills. They'll be responsible for 10%. And remember, the most they can ever pay per year in that 10% is $5,000 for the year for the whole family combined. And if they ever hit that number, again, at that point, Impact's community will share in 100% of their eligible medical bills. Now, let's say that you get your quote and you say, wow, I want to sign up for that. All you would do is just scroll up and hit enroll now. It only takes about 15 minutes to sign up as a member. Your Impact membership will begin the first day of the next month. And if you have questions, you want to learn more information, you can literally just put yourself in as a lead, name, email, and phone number, click on learn more. Impact will text message you within an hour to schedule a time for a little consultation call, answer any questions you have. And if you like what you hear, you'll be redirected back to your referral partner's link to sign up as an Impact member. So let me just put in my date of birth, just to give you guys an example. So for me, March 30th, 1979. And for my wife and I, we are a family of 2, just the 2 of us. So we can see family of 2, get quote. And again, instantly there generates a new quote for my family. So you can see for my family, anywhere from $306 a month to $479, depending on our primary responsibility amount that we choose. Let's give one more example. We'll make somebody a little bit younger. Let's say 1992 for the date of birth, and just one single individual, get quote. And you can see as low as $102 a month for that individual, or as high as $246 a month, again, depending on what PRA that they choose. So that's how the quoting process works. Really simple. And again, if you have further questions after this call, you can submit yourself in as a lead, and somebody from Impact Health Sharing is going to get back to you. Now, we also do have a program for seniors. Anybody that's 65 years old or older that has Medicare Part A and Part B, they can utilize Impact as their secondary, meaning those individuals that currently have a supplemental plan, Impact secondary plan for seniors can go ahead and replace that as long as they have Medicare Part A and Part B. Now, in our plan, Impact for Seniors, there is no such thing as a pre-existing condition for seniors. Anybody, again, that's 65 years old or older that has Medicare Part A and Part B, there is a $1,000 annual PRA for you as a member. The price ranges about $96 a month to $140, depending on how old you are. And Impact will share in everything that Medicare Part A and Part B does not cover. So Medicare Part A and Part B covers about 80% of your eligible medical bills. Impact will kick in and they will share in the difference. Your responsibility is just that $1,000 PRA. And if you also have Medicare Part D, we will also share in your prescription costs as well. Now, when it comes to the benefits of Impact and some of the things that really makes us stand out, Lauren mentioned there's several other great health sharing companies out there. You may have heard of companies like MediShare, Christian Health Ministries, Samaritan. All these companies have really paved the way for more contemporary and modern approaches like what Impact is offering to their members. And, the largest health sharing entity in our country, their former president and CEO, those individuals actually scaled that health sharing company, MediShare, from 8,000 members to 150,000 members in just a few years' time. It was the fastest growth curve ever in the history of this industry. And those individuals wanted to be more technology focused, more streamlined, more contemporary, more modern. And those individuals, really weren't able to go out and get that company to make the changes that they were looking. So they broke off and started their own technology company. They became a consulting company in this industry. They were introduced to the executive team with Impact Health Sharing, and together those two entities launched what you're seeing here today. And you're going to see a demonstration of that technology platform in a minute that has us best in class, most transparent, industry leading. Impact was the first company to launch this patented technology platform that makes Impact look and feel like traditional insurance, even though it's health sharing and not insurance. What really makes us different is how we manage our billing. And you'll also see what our reference-based repricing model looks like. But here's the process when you go to the doctor using Impact. This is what an Impact membership card looks like. All of our members get a free annual physical, free annual wellness visit per member of the family annually. Also a $150 blood work credit per member of the family. We also have where you can use that blood work credit anywhere that you want. But we also have a nationwide agreement with Quest Diagnostic Labs, where we already have contracted negotiated rates with Quest, that if you go out and get your blood work done with Quest, you can go into the grassroots center and our member center and schedule the blood work, the annual blood work right there. And 100% of those recommended annual blood work programs will be reimbursed by Impact if you go with the Quest program. If you want to have additional labs run, you can do so. And as a member, we get a really nice discount through that Quest program as well. Our members also get up to 50 outpatient therapy visits per year, which are not subject to a provider fee, which is like a copay. So what does outpatient therapy mean? That means chiropractic visits. That means physical therapy. That means occupational therapy, respiratory therapy, etc. So up to 50 visits per year per member of the family. And again, you are not subject to a provider fee on those visits. As Lauren mentioned, also 24/7 free unlimited telemedicine. We also have a teledoc for mental health as well, which is a specialist visit in that case. So specialist visits are $75. You can see an office visit after your annual wellness visit is $50. You can see ER and inpatient is $150 and so on. But if you look on the back of the card, you'll see the Impact Payer ID number. And this is something that's really significant in the health sharing space because when we go to the doctors using our Impact card, most doctors' offices expect a health sharing member to pay cash pay as a cash pay discount. Well, with Impact, all the provider has to do is put in our EDI payer ID number into their billing system. And at that point, they can actually bill Impact directly. Now, we're very provider friendly. That's why we have so many providers becoming preferred providers, where we're paying our providers faster, and in many cases more than they're getting paid by the insurance companies. Last month, on average, we were processing and paying medical bills in under 17 days' time. This is music to a provider's ear. And so again, all they do is put in that payer ID number, the bill gets sent electronically to Impact, and Impact takes care of going out and and paying that provider, negotiating the rates. And so it's a really, really great and transparent situation. Now, if for any reason the provider says, well, I've never heard of Impact, hey, I don't know how this works, or hey, we don't accept health sharing here, this is sometimes going to go out and happen. We call it provider pushback. Well, if that ever happens, it's okay. You can see right above the EDI payer ID number, there's a provider support line. Just tell the provider, look, call the number on the card. Now, look, total transparency, guys. Sometimes you're going to have to tell them a second time, no, call the number on the card. And when they call the number and they hear how quickly Impact pays and how much Impact will pay, the majority of the time they're going to say, wow, this is great. We do want to bill Impact. Now, if for any reason at that point they still do not want to bill Impact, in those cases as members, remember, we can go to any doctor we want anywhere in the country. There is no network. But if they're not willing to bill Impact, it's okay to say, hey, listen, just bill me as a cash pay discount. You can pay that cash pay rate, and you can take that medical bill, upload it in your Impact Member Center. And as long as you've hit your PRA, Impact will reimburse you as fast as they're paying their providers. If you haven't hit your PRA yet, whatever you pay will simply just be taken off against your PRA. And then the other thing it talked about is it talked about our reference-based repricing. And we've actually have a member spotlight on the call here today that I'd love to have him just share what he saved for Impact. Impact's also available for businesses. He's now able to actually offer this to his employees, but he's going to show you a couple of his medical bills. And you guys will really get a chance to see how Impact advocates for their members when it comes to this reference-based repricing model. And Jose Ramos out of Tampa, thanks for being on the call here today. And I'd love to thanks for being willing to share your Impact story and show what some of those medical bill repricings look like.
Absolutely, Jeff. Thank you so much for having me on this call. Guys, those of you that don't know me, my name's Jose Ramos. I'm a traditional business owner by background. So healthcare, like a lot of people, was always very expensive for me. I used to be with traditional health insurance. We paid over $1,000 a month for our premiums, $7,500 deductible per person in the family. So if we all got sick at the same time, $22,500 were going to come out of pocket before my $1,000 a month policy paid a penny. So when I took a look at Impact, I was excited because the first thing I saw is my savings. We saved $420 per month off of our premiums. We cut our deductible down to $2,500, so $20,000 a year in deductible savings, and eliminating the networks. And just to Jeff's point, I'll show you what some of those bills actually look like here, because it's pretty impressive. So when you become a member, you get a back office, and it looks just like this, where here's a bunch of the different medical bills that we've had. The first one I have pulled up, this one was for my wife. So this was she had a treatment at the hospital. Whoops, where'd it go? Sorry. She had a treatment at the hospital that we had to go in for, and the bill came in at $4,900. Impact got a hold of that bill. They repriced it. They lowered the bill down to $4,375, leaving the amount due $603.51. After we've already hit our primary responsibility at this point, so we were just responsible for the 10% of that bill. So we paid $60.35 for that hospital visit, right? Myself, I had a cardiac event that I was going through last year, and I spent about 4.5 hours in the hospital getting diagnosed. This was the medical bill that came through. Now, this was the first bill we had for the year, so we didn't hit our deductible at this point, our PRA, but that bill came through at $22,622. Now, if I didn't have any kind of insurance, that would have been the bill I would have had to pay, right? But Impact got a hold of that. They repriced it down to $1,155. I gladly paid the hospital $1,155 because that went towards my PRA, and then the rest of the year, I just had to come up with the difference of the $2,500 primary responsibility amount, and then down here, here's a bill for my daughter. She had a fever that wouldn't break. And it was like 4 days. She had a fever of 103 degrees, and we just couldn't get it to break. So we decided to finally take her to the emergency room. We spent about 13 hours in the emergency room with her. They gave her an IV, they gave her some medications, but that was literally about all they did for her, right? So they sent the bill to Impact, $14,200. Impact looked at that bill, they renegotiated down to just $484, right? The share community picked up $300. We were left with $183 on a $14,000 bill, right? So the repricing is absolutely incredible. It's nothing like I've ever seen before. And with that being said, Jeff, I'll throw the call back to you, buddy.
Well, Jose, thank you so much for being on as a member spotlight today. And as Jose mentioned, if he had not had insurance, here's what the bill would have been, and he would have had to try to negotiate that bill himself. There would have been nobody to be able to advocate for him, on his behalf. That would have been his responsibility. Matter of fact, Lauren mentioned her husband's roofing company. Here's another bill from one of their employees that previously was one of the 26 million Americans going without health care because she couldn't afford it. Even though they were offering it as an option, she was opting out because she was not able to afford what her responsibility was going to be every single month with those insurance premiums. Shortly after they started offering Impact as an option for their employees, she said, you know what, this is something I want to do. She picked a plan for herself that was $153 a month. There was a $5,000 PRA for herself. Just a few months later, she got into a car accident. And her, she fractured her leg, and her bill came out at $200,000. Impact repriced that bill to $20,172. With that $20,172, she had a $5,000 PRA. This was her first medical bill. So she ate up that whole $5,000 PRA in that one bill. So that PRA is now met for her for the year. And then she had her 10% co-share. So her responsibility was $6,517.26. The community shared in $13,655 of that medical bill. Here's a personal friend of mine that I personally introduced to Impact, Rick Bayek out of Connecticut. And Rick's wife went through multiple different things. She was treated for potential cancer. She had a lot of different bills that were piling up. This was one of those medical bills, $37,000 bill that got repriced to $14,000. She had already met her PRA. All she was responsible for was that 10% co-share. The community shared in $12,613 of that medical bill. And here's the note that Rick sent to our little group chat with Impact Health Sharing. Good morning, all, and happy Sunday. Was just in my Impact portal and wanted to share this screenshot. The power of what we have our hands on here. I was once skeptical because we all know it sounds too good to be true. But Impact is truly a blessing for my family. This is one of several from my wife Michelle's surgery, but to date, this is the biggest bill. And I can tell you that when I first heard about this, I was like, Rick, like, how am I going to save all this money? It's going to go out and, it's too good to be true. But today, man, I am a crusader when it comes to really sharing what kind of an impact the Impact can make in our community. We also do have Impact for groups. So our target market for businesses, 49 employees or less. And we have on average receiving businesses 40 to 50%. My wife and I just gave a small business here in Flower Mound, Texas, where we live, with 8 employees a quote that was literally going to save them over $40,000 a year when it comes to their healthcare costs. But here's the last piece, and then I want to take any questions that you guys have. We talked about the technology platform. We talked about Impact's Member Center. I'm just going to log into my own personal Member Center on impacthealthsharing.com. Also on impacthealthsharing.com, they do have frequently asked questions. There's a lot of great information that's on this website. For folks that want to learn about being a preferred provider, you can click on providers on the website, fill out a request to be a preferred provider. Again, we're paying you faster and in many cases more than you're getting paid by the insurance companies. And for providers on the line, on average, we help our providers are getting approved as preferred providers in under a week on average. I know for many of you, it's taking 8-9 months to be credentialed by an insurance company. You can be a preferred provider on average on under a week. And our goal is to go out and have more clients come into your office by being on our preferred provider list. But as I log into my own personal member center, here in my Impact, login, remember Impact's a nonprofit company. So when somebody logs in, one of the things I love is just the philanthropic feel. You can see on our member portal people that are contending for each other, people that are praying for each other. So I just love that right there you see need prayer for a new job opportunity. You see people that have different situations with their medical bills. But look here, I was notified just 2 hours ago that my sharing account was matched for this particular family. Jeffrey, you and 36 other Impact Health Sharing members have been matched to help the Nesger household pay a medical bill of $5,575. An amount of $12.05 will be debited from my share account. Here is another one where $127 was debited from my share account. But I love that now I can see where all the money moves. I can see when I pay my healthcare bill every single month, I now know where that goes. Now I can send a prayer request to these families. I can tell them that, hey, I'm somebody that contributed to you. I just want you to know I'm thinking of you, or I can remain anonymous, but I love knowing where my money goes. Now you can actually look at your own share account. This is called decentralized reserves. So I'm going to just log in. Here's my own personal Impact, member account. This is my account right now. There's $1,200 just sitting in my, account. And you can see over the last several months, anytime money was taken from my account and moved to another family, I was notified. You can see the U household, the Beck household, the Fish household. I can see what percentage goes towards the sharing community, what goes towards administrative fees, what goes towards program fees. It's 100% transparent. You can see where all the money goes. You can even see the overall health of the community. Now, the goal of a good health sharing company is to have 3 to 4 months of financial reserves. Well, what's amazing is Impact has more than double that. Matter of fact, we are so fiscally strong, the Impact in the next couple of weeks is going to be making some of the biggest announcements in the history of the health sharing industry, where they're going to be talking about how they're going to go out and really bet on the preventative approach of individuals that are taking care of themselves, that are going the holistic route and offering some really, really exciting incentives for people that are taking care of themselves because of the fact that they have so much money in financial reserves. But look, you can see how quickly we're processing bills. You can see the largest shares from last month, $76,000 for the Walker household, $48,000 to the Pacheco household, but it's just 100% transparent. It's all there. And then also Lauren talked about the prescription program. If somebody has a prescription that they want to get a price on, they can simply go right into their member center. We have the best wholesale prescription pricing in the industry, and they can literally just go out and they can click on a particular prescription. They can type something in. Let's say somebody wants to look up the price of metformin, and it'll show them it competes all the local pharmacies against each other, so they can always find what pharmacy is going to give them the best price for the prescription that they're looking for, and so they can go there. And some of the stories we've heard of prescription discounts have been absolutely phenomenal. So I'm just going to look up tablet form for metformin here in my local community, where I live in North Dallas, and you can see, look at this place, it's $1.58. At this one, it's $1.83. Now, I don't think anybody's going to choose a different pharmacy based on, 20, whatever that is, 25 cents. But I've seen some cases where one location was $50 cheaper. So I love that we have this available. So guys, we just went through a bunch of information for you. Our goal was to do it in 45 minutes. We did it in 46. So what we want to do is at this point, just be able to open up for any questions. For those of you that are here, it's your first time on the call, I really want to cater to you. And there's a reaction button. If you click that reaction button, you can raise your hand. We want to be able to take any questions that you have. We'll get any of your questions answered. Again, those of you that it's not your first time on, I'll stick around at the end. I'll get your questions answered as well. But I really want to make sure that we can cater to those of you joining us for the first time today and make sure your questions are answered. I see Glenn, I saw you had your hand raised, so would love to be able to, unmute you. Joseph, you're on deck. And, Glenn, thanks for being on the call today.
Thank you, Jeffrey. Thank you for the opportunity. I got a quick question. What is it the term PRA? Am I correct?
Yeah.
What does that actually means?
So a primary responsibility amount. So that's the health sharing word for it. As a lack of better words, that's just the term in the health sharing space. It means the exact same thing as a combined family deductible. So again, for my family, we have a $2,500 PRA. So that's a combined family annual deductible for my wife and I. So once we meet that $2,500, then at that point, we have that 90, we're eligible for sharing, and we have that 90-10 split with a max out of pocket of the $5,000 on those co-shares like we were going over earlier on. Does that help you, Glenn?
Yes. So if I had to go to a doctor or anything like that, and the bill is more than 2,500, am I responsible for the first 2,500? Is that what it is?
Yeah, and remember, Jose was a great example. Remember, he had that $20,000 bill that he showed, $22,000 before he had ever hit his PRA. So they still negotiated that bill on his behalf, I think down to $1,100. So again, he had not, that was his first medical instance of the year. So they knocked off 20,000 plus of that bill. The $1,100 that was remaining, he was responsible for that. Now 2,500 minus 1,100. Now there was $1,400 remaining of his PRA. Does that make sense, Glenn?
Got it. Yes.
Yep.
Got it.
And let's say that what you were left with at the end of the bill was $4,000 after they negotiated it. Again, if you remember that other bill I showed where it was a $200,000 bill, they negotiated here. Let me just show you. This will be great for everybody. Really great questions, Glenn. Thank you.
Thank you. No, thank you for the information.
Yeah, so remember here, this is a great answer to your question. $200,000 medical bill. It was repriced to $20,000. So the member, like, they hadn't met their PRA yet. They weren't responsible for $20,000. They were responsible for their $5,000 PRA plus their 10% co-share. They were responsible for $6,500. They've now met their PRA for the year. The community shared in the remaining $13,600 for them. Does that make sense?
Wow. So from the 200,000, after everything that it happens in the back end, he was only responsible for the 6.
Yeah, 6,500 plus they've now met their PRA for the year. Now they're only responsible for their 10% co-share on any future medical bills. And they've already met 1,500 of that $5,000 max for the year in the co-share.
That's awesome. Thank you for the information. That's clear enough. Thank you.
Absolutely, Glenn. Thank you. Joseph, I see you got your hand up. And guys, anybody else that you're new on the call and you want to ask a question, raise your hand so we can, chat with you, next and get your questions answered. Go ahead, Joseph.
Question I got is we have my wife, we're getting ready to take her off of traditional insurance and put her on this. I know you said there's $150 lab work credit. The doctors that we've been going to do a lot of blood work, a lot of it. And because that's the way they know how, to treat. So the question I have for you is, say we go to the doctor and she prescribes, or she asks my wife, let's go get 15 different tests done. If we go to Quest, we present our impact card. Are they going to reduce down our bills on labs not associated with our $150 annual labs?
Yes.
Will they negotiate that down, or are we responsible for the full amount of all of those labs?
No, they will negotiate it down. And so I literally had somebody that sent me a bill from LabCorp that was $2,000. Impact repriced it down, I think, like $270, they got their $150 lab credit. They were left with the $120. Now, in our grassroots program in your member center, Joseph, and again, you can get that done anywhere you want. But if you do go through the grassroots program with our Quest, which is our negotiated rates with Quest, all of the recommended annual labs will be 100% reimbursed if you go that route. On top of that, if there's additional labs, there is already a negotiated discount. So you can see what those rates would be on your back office in your member center. And again, or you can just go wherever they'll bill Impact, and Impact will negotiate it for you afterwards. But that information will be right available for you if you do want to go the route with the grassroots program through Quest. Does that make sense to you?
It does. It does. That's the main thing we were worried about, is because a couple of doctors were talking about approaching to actually sell this in their, or to be a share provider, whatever the case may be with them. Both of them require a lot of blood work. There was one time that I went because we were trying to figure out what was going on with me, and the lady pulled 43 vials of blood, and some out of both arms, and my bill was almost like $9,000, $10,000, something like that. And that's what I was wondering, because these are not normal everyday tests that they like to do. So that's what I was wondering.
Yeah, we also have one of our referral partners on the call that I'm going to have share in a couple of minutes, Dr. Randy Shannon. She might have some additional thoughts for you on that. My question for you is, did you pass out, or did you walk out on your own power? So
no, I walked out, but it was a little sketchy.
yeah,
So,
man, I take 2 vials of blood for me and I pass out, man. So yeah. You're a better man than me, Joseph. But yes, they will renegotiate all those for you. William, go ahead. See if we can get.
You can hear me?
Yep.
How do you go about enrolling an Impact if you don't have insurance?
Yeah, so that's again, whoever sent you onto this call, William, they would send you their referral link, their referral partner link, their affiliate link, and just like I showed you before, you just click the enroll now button, and there's it's all based in the honor system, so there's no blood work required, there's no urine sample required. You will become an Impact member, and your Impact quote unquote coverage will begin the first day of the next month. So it only takes about 15 minutes. So again, just to give you another example of that, William. So here is, here right on our referral partner link, if you just hit shop now, right where you would go to get your quote, you could actually just hit enroll now. And right here is where you would go. You'll fill out a medical questionnaire, and it'll take about 15 minutes for you to sign up for coverage. There's a one-time application fee at the time of you or your family signing up. That's $79. So you pay that. You set up your EFT or your monthly drafts with Impact, and your coverage starts the first day of the next month. Does that help you?
Yes, sir. Yes, thank you.
Absolutely. Great question. Courtney, go ahead.
Okay. Sorry, the baby just started crying. Can you hear me okay?
Yeah, absolutely.
Okay. So I just had questions around businesses. So like most businesses can have both on their, like they can have regular insurance and then they can have Impact as well. Is it just by an individual basis then that they do each person then, or how does that work? And are there any fees along with that with businesses? Like, because people ask me about the fees and I didn't think there was, but I just wanted to kind of check and see.
Yeah, so if they want to have a group dashboard to manage, their whole like employee base, I forget the actual price, but it's under $100 a month, Courtney, to be able to have that feature where it might be like, I don't remember the exact amount. It's less than $100 a month, not per individual, like for the whole plan, for businesses that want to have that. And yes, like you would just submit that business as a lead. They would get a quote back from Impact, and the Impact group administrator will go out and give a presentation for their employees, like on a Zoom call. And any employees that want to opt in, they'll get sent a link where they can go out and sign up for Impact. And then the business owner can determine what percentage of somebody's monthly health care does that business owner want to cover. That's totally up to the business. Some businesses cover 100%. Some cover just for the employee. The employee is responsible for their family. Some contribute $200 per employee. So they can make that choice, and then the employee can either opt in or opt out. So to your point, many businesses will give them the opportunity where if they need to stick with traditional insurance, maybe they got a big pre-existing condition, or for whatever reason, they just don't want Impact, they can stay with the traditional insurance. Many of the employees will decide that they want to go the Impact route. Does that answer your question, Courtney? Thumbs up? Perfect. All right, we're going to go E means, and then after E, I'd love to also hear a few words from Dr. Randy Shannon, who's on here as well. But E means, if you can unmute, would love to be able to help you. Can you hear me? Well, you're unmuted, but I don't think your microphone is working. So while you try to get that figured out, I did see Dr. Randy Shannon on the call here today, and she's somebody, a big advocate of Impact, former Fox News analyst, somebody that's really an impact player in her community, one of the top naturopathic doctors actually in our country. She brings a ton of value, and would love to hear a little bit about your perspective of why you're so excited about Impact. And I know you'll add a lot of value here to the last few minutes of our call.
I could go on and on, like almost as long as this Zoom was today, with all of the amazing things that I feel about Impact Health. And to the previous gentleman, 2 vials of blood would make me go a little wheezy. I'm a naturopathic doctor, so I don't deal with blood, straight on, or cuttings or surgeries or anything like that. But my expertise is I look at faces, fingernails, and tongues, and I can see what's going on with the organs of the body. So my expertise is super rare, and I don't need all of that equipment. So, in my entire career, I've never, ever picked up insurance. I think I had it when I was much younger, when I was having kids. But today I'm 56 and they're all grown. But I got to tell you, I looked at Impact. Somebody shared it with me, and I got myself on the program. And at 56, all I am paying is $150 per month, which is absolutely unbelievable for that kind of pricing. And for my entire career, I've had people come from all these other companies like Blue Cross, Blue Shield, Cobra, Kaiser, all these different companies, and they are spending an arm and a leg. And it's one of the #1 reasons for bankruptcy in this country, which is really unfortunate. What I love about Impact is it does have a 98% retention rate. That right there speaks absolute volumes of people coming to this and not leaving. You guys, that's huge. And this is a $4.4 trillion industry. It's grassroots, which I love. It's made in America, which I love. And it's really true medical freedom. I've never heard of a company ever that has one PRA, or is what the masses would know as a deductible for the whole family. They have one, whereas all the other companies have one per family member. We have a chiropractor that is, I believe, on here and joined our team just in the last few weeks. He joined our Impact referral family, and he's got something like 7 kids. So they're not having to put that PRA on every single one. They're all covered under that one umbrella. I spoke with a woman today who has Cobra. We're going to save her on this plan over $10,000 a year. And it's, what other company out there is including, I think I wrote the note, up to 50 different outpatient visits for all the chiropractors looking at this. This is a windfall for you to be bringing these clients on, because you have guaranteed pay. You're not going to have to wait. And, when they're paying the doctors in 30 days or less, and an average payment to the doctor of 17 days, trust me, your doctors are going to be super happy to actually have you using this type of a program. And there's other companies out there, but nobody ever pitched them to me. Nobody ever pitched me Blue Cross Blue Shield unless they were trying to get me as a client. This actually has a referral program. So, you know, I'm telling this to all my clients, and I have thousands of clients in 18 different countries. I can share this here all over this country with my clients. So again, that's huge. It's just one good point after another. And I have never in my entire career gotten behind something like this. So, you know, it's a slam dunk. It's a win for everyone, whether you're looking at it as being a customer or, you know, actually being a referral partner. It's huge. I invited many people on here today, and I will keep inviting people on here, whether they're my customers or people that I think would want to be interested in this for their own practice, or, you know, the country's getting squeezed. So this is a great way to, you know, especially for people in the holistic field, to really supplement your practice and share this with all of your clients. So it's huge. And I thank you for the opportunity of sharing my bullet points on here and why I love Impact so much. I just, there is nothing else when it comes to a healthcare coverage, a healthcare sharing program. This is it. And the whole motto of, you know, they won't, you know, support some of the craziness that's going on around the country. You know, I love that too. I love that it has Christian based, you know, platform. I love that. So thank you. Back to you.
Well, Dr. Randy, thank you so much for being on. You had some amazing insights. I want to give a special announcement as we start to wrap things up. E-means, I will get to you here in a second, make sure your question is answered, but a very special announcement for everybody. We have Phil Chrysler, the CEO of Impact Health Sharing, that'll be joining us on our call next Tuesday at the same time. We're going to have the CEO of Impact Health Sharing that's going to be on there talking about today, Impact today and Impact in the future. And it's going to be an amazing call next week. But Dr. Randy, I couldn't agree with you more on some of the additional points that you made. So thanks for sharing. And E-means, were you able to get yourself unmuted and figure out how to ask your question there?
Yes, sorry. I have a question regarding the pre-existing conditions. Is there a grace period that eventually that will end off of the pre-existings where they will pick up and cover? And I guess more specifically, I have a son who he's 7 and he has kidney stones. So he has to have ultrasounds every 6 months. Would that be something that would fall under, it would not be covered?
So somebody has to be sign, symptom, treatment, diagnosis free for 36 months. Once they've been signed, symptom, treatment, diagnosis free for 36 months, any future things, in that case with kidney stones, would be shareable by the community. He has to be signed, symptom, treatment, diagnosis free for 36 months. He can be a member right away, but again, they've got to be signed, symptom, treatment, diagnosis free for 36 months for something to become shareable.
Okay, is that only on things related to the kidney stone, or is that in general all of his healthcare needs?
So anything, like let's say that the kidney stone is the only thing going on with him right now, he can be a member, and any other medical situation that has nothing to do with that is shareable right away. It's just specifically from the kidney stones in that example, those medical expenses would not be shareable until he was signed. They'll still reprice them for you, as Lauren showed in that example. They'll negotiate them for you and advocate for you, but those will not be shareable until he's signed symptom, treatment, diagnosis free for 30
Got it. Okay, and then can you touch and explain again on, I think you said something at some point, then 100% of the bill would be covered by the community, or did I misunderstand that?
Yeah, so the 10% co-share, once you've met your PRA, there's a 10% co-share. The max that your family could pay per year in that co-share expense is $5,000 a year. So remember how I showed that bill where, you know, $1,500 of it was part of the 10%. I said now they had $3,500 left in co-sharing. If they hit that 5,000, at that point, there is no more co-share. The community shares, in as long as it's an eligible medical bill, not a pre-existing condition, and then Impact's community would then share in 100% of that medical bill.
Okay. And then as far as like your rehabs, speech, I think you call it outpatient, I can't remember. Speech, OT, PT. You said they will allow 50 visits per year.
Yeah, 50 outpatient therapy visits per year that are not subject to a provider fee as long as they're not a pre-existing condition.
Okay. All right. And then outside of the on the website, they have information about becoming a provider
Yep.
within the community. Correct. And we don't have to be a member and actually have the insurance. Or
Yep. Correct.
Okay.
Yep, you're absolutely right. And then again, just one more reminder, I touched on it briefly, but Dr. Randy did a great job mentioning again. Those that are like, hey, I want to learn more about being a referral partner. Yes, there is a residual income business opportunity here for those that want to be referral partners and share impact with other individuals, families, or small businesses. So make sure you get back to the person invited you on the call and say, hey, I want to learn more about being a referral partner. Preferred provider is completely different. It means that's just you know, again, being on the Impact Member Center as somebody that's a recommended doctor in that particular area. But for people who also want to learn about the business opportunity here, make sure you do get back to the person who invited you on the call and let them know you want to learn more about that. So we're going to look to wrap things up. Does anybody else have one more question before we wrap up? Well, guys, God bless. Thank you. Lauren, go ahead.
Yeah, we just had someone post in the chat from Roger. He said, curious, do veterans and their families see any value in impact, or is VA always adequate for their needs?
Yeah, so we do have multiple veterans that, you know, and for all the veterans on the call, especially with Memorial Day, a weekend coming up this weekend, thank you so much for your service and for all those who have, you know, family that sacrificed, you know, the ultimate sacrifice for our country. We greatly thank you and your families. But we do have several, you know, veterans that do have the free healthcare for being, you know, for being military in our family, in our country. It's called TRICARE. So we do have many military vets that, you know, on top of their TRICARE, also have impact as a supplement, because remember with not a supplement as a secondary healthcare, because remember with impact there is no network, and sometimes there are only certain doctors that our vets can go to. So we do have many vets that have their free TRICARE coverage, but they also have impact maybe on like a $10,000 PRA plan or whatever, a high PRA plan to have it if case it's something that they need. So that would be to their you know, their discretion, but there are certainly some that say that there's a lot of value for them to also be an impact member. And remember, you could submit yourself as a lead and talk about your personal situation and get any of your questions answered by Impact. Well, guys, thank you everybody for joining us. Again, those of you that want to come back and join us next week, we're going to have the CEO and founder of Impact, Mr. Phil Chrysler, on our call, and it'll be amazing. So God bless, have an incredible day, and thank you all for joining us here today, and we hope that you served you here today.